Hello and welcome to Module 3, Altered Oxygenation, Respiratory. As you guys look at this picture, I wanted to go over the anatomy and physiology, just a quick review, and also talk to you a little bit about how we breathe. Let's look at the respiratory system. You know what it does. I want you guys to be able to label all of these as I talk. So the respiratory system, it does include the upper airways, the lungs, the lower airways, and alveolar sacs. Air with oxygen enters the nose and mouth and moves through the airways, the trachea, bronchi, bronchioles, and into the air sacs, alveoli, of the lungs. Now, once in the air sacs, the oxygen from the air diffuses in the blood so it can be transported to all tissues and organs. Now watch how carbon dioxide, which is CO2, the waste gas created in the tissue diffuses from the blood into the lungs so it can be exhaled. Now we should all know what gas exchange is. Gas exchange is the oxygen transport to the cells and carbon dioxide transport away from the cells through, what do we call it? Ventilation and diffusion. Don't forget, perfusion is the arterial blood flow through the tissues, that's peripheral perfusion, and blood that is pumped by the heart, which is also called central perfusion. With that being said, remember all systems depend on adequate gas exchange for tissue perfusion. In short, any respiratory problem, it affects your total body health and, of course, well-being. Here's a quick video of the respiratory system. Great video, but now let's focus on our patients. So when we start talking about our older adult or even doing our respiratory system history, I want to make sure you guys now I will be speaking in the Iggy book and PowerPoint. So I want to, the Iggy book, I say Iggy, and I basically mean Medical Surgical Nursing, 9th edition, Ignatavios, Workman and Rebar are the authors. So I want you guys to look at this and look at the aspects to assess in respiratory assessment. You asking them about a smoking history, childhood illnesses, adult illnesses, any surgeries, things like that, recent hospitalizations, what was their last chest x-ray, any night sweats, problems sleeping at night, shorter breath when they walk, shorter breath just walking from the bed to the bathroom, or going up a flight of steps. All of these are part of our respiratory assessment. In your chapter, your respiratory chapter, I wanted to focus on assessment strategies and approaches. So you see when you're listening to your lungs, you're going, I like for you guys not to go over that scapula. So that's why we listen inner and then we out. We definitely don't want to listen over bone. Okay? As we continue on with our assessment, I wanted to read what the Joint Commission requires. They require documentation of screening for tobacco use and that a tobacco treatment program be offered or provided as part of their quality. So when patients are, we find out patients are smokers, we offer them the nicotine patch or the gum to try and help to decrease that urge of smoking. And then also we make sure that we give them information at time of discharge for smoking cessation classes. Also with smoking, there's a drug alert, and it also says teach adults using drugs for nicotine replacement therapy that smoking while taking these drugs greatly increases circulating nicotine levels and the risk of stroke or heart attack, because smoking is more of a vasoconstricting. It vasoconstricts. So if you don't want anything vasoconstricting, because that means less blood and oxygen flowing to the heart. When we're talking about smoking, know that that's a modifiable factor. So when we do our teaching at the bedside, we want to make sure that we let the patients know that they have increased the risk for cardiovascular disease, stroke, and many types of cancer. Also, when we're doing our respiratory assessment, know that many additional respiratory changes in older adults results from hereditary and a lifetime of exposure to environmental pollutants. So we do have to ask about cigarette smoking, bacteria, even if they worked in an industrial area because of those industrial fumes, and also irritants. Let's move on. Here's a quick video on respiratory assessment. Along with your assessment, you need to make sure you look at your diagnostic assessment. That includes a lot of your blood work. So some of your blood work includes your RBCs, which is your red blood cells. The RBC count, it does provide data about oxygen transport. Now your hemoglobin, of course, it is found in your RBCs, found in your RBCs. It transports oxygen to the tissue. Then we all know if there's a deficiency in hemoglobin, could cause hypoxia. I'm sorry. Also, we do other tests called arterial blood gases. We also do chest x-rays. We do CT scans, different more detailed examinations to look at the chest. And then also with the CT scan, we want to ask the patient whether he or she has any known allergies to iodine or shellfish. Okay, because in addition, IV contrast media, they can be nephron toxic. So ask if if the patient's asks about their kidney function. You want to know their BUN and creatinine, and you also want to know if they're a type 2 diabetic, because if so, the patient is normally the patients, they take metformin, so that particular drug is stopped at least 24 hours before the contrast medium is used and is not restarted until adequate kidney function is confirmed. So it's very important. I want to scroll down so you can also see the rest of the tests that we're speaking of. So, and you guys can always pause. And this is found in chapter 27 of the MedSurg book. In the video, it did show the pulse oximetry, so make sure you're checking your patient's pulse ox. Also, once you're in advanced MedSurg, you'll talk about capnography, pulmonary function test. They also do that. So there's a lot of different diagnostic tests that the patients go through. Read this assessment and check your clinical judgment and see what other things that need to be done. Look at questions 1, 2, 3, and 4. Based on your readings and the test and the people that we speak to, that teamwork and collaboration, see what you can come up with. Test your knowledge. In chapter 27 in the MedSurg book, I highlighted this whole area. Is very important. This benzocaine, it can be a little booger bear. So make sure you read about the benzocaine spray as a topical anesthetic to numb the oropharynx. But look what happens later. So if you get a patient that's coming back and they're hypoxic, they're changing colors, that in their skin, they become cyanotic, you need to notify the doctor right away. Right away. This is considered emergent. Make sure you notify your doctor right away. And these are the other tests. I just wanted to scroll down. I'm not good at scrolling. But you do have thoracentesis that are done, and there's the young lady at the bedside. Our job as nurses is to assist the patient and keep the patient calm and very still. Okay, and then also we have the lung biopsy. But with the lung biopsy, I wanted to go all the way down if I can find it in here. And I want you guys to focus in on pneumothorax. You need to be able to assess a pneumothorax. And I can't find it in here, but on the page, I think I'm going a little too fast. Let me find it and I'll get right back. This is chapter 27, page 527. Very important for you guys to know the signs and symptoms of a pneumothorax. I also highlighted at the very bottom what this patient needs to do. Go to the nearest emergency room, and if they're unable to, they're to call 911. Sometimes you get pneumothorax after a thoracentesis, and then also sometimes after a lung biopsy also. We will continue with Module 3, Altered Oxygenation Respiratory, with Part 2. Please look forward to Part 2. Thank you so much, and take care. Part 2, we will talk about care of the patient requiring oxygen therapy or tracheostomy.